This meeting is being recorded.
Hello everyone, I'm Hongru Meng, and today I would like to share with you about orthotic devices and its application in treating Duchenne muscular dystrophy. So first of all, what are orthotic devices? Orthotic devices are basically braces that help support weakened muscles. They are also called orthoses, and they are designed to wrap or cradle the joints or areas of the body they are intended to help. This is a picture of a typical orthosis. So orthoses can be custom-made, they can also be mass-produced. And that means you can easily find them in pharmacies, in athletic stores, and even some large retailers. The main function of orthosis is to enhance comfort and help slow the progress of muscle contractures for muscular dystrophy patients. And that is the reason why many physicians would recommend their patients wearing orthosis when possible. There are three main types of orthosis. The first one is called ankle-foot orthosis, and that is the device shown in the picture in the last slide. So ankle-foot orthosis cover the foot, the ankle, and the leg below the knee. They are highly durable and they're mostly custom-made to the individual's requirements. They help increase mobility and reduce pain while walking. Another more extreme type of orthosis is knee ankle-foot orthosis. And as you can see from its name, it is very similar to ankle-foot orthosis, but it also covers the knee joint. So knee ankle-foot orthosis help in preventing excessive joint motion, so to lessen joint pain. They basically limit the movement of your knee joint. They are also custom-made, and they are mostly made of lightweight materials. And as you can imagine, if you're wearing a knee ankle-foot orthosis, you will need to put more energy into walking because the movement of your knee joint is limited and you need to walk in a relatively strange gait. The last type of orthosis are wrist and thumb splints. And these are probably the most common ones. You can purchase them from many places. And they are designed to assist people with weak forearm muscles to grasp small objects. Because remember, your forearm muscles are mostly controlling the movement of your digits. So now we have some basic knowledge about what are orthoses, and now let's look at how orthoses are utilized in treating Duchenne muscular dystrophy. But before we go into that, I would like to review a topic we learned from our lectures, and that is stretching exercises. We all know that stretching exercises are essential for maintaining the flexibility of muscles for DMD patients. However, if one uses his muscle too much during daily life, the benefit he gets from doing stretching exercises can easily be eliminated. And that is where orthosis can come into play to basically limit the use of muscles and to maintain the benefit he gets from doing stretching exercises, and eventually reduces muscle contracture. So if orthosis offers such benefits to DMD patients, are all DMD patients wearing orthosis? The answer is no. And actually, the use of orthosis for DMD patients is a highly controversial topic. Why is that? One of the main factors that leads to the controversy of orthosis is patient tolerance. So many patients complain that they cannot tolerate wearing orthosis for several hours a day because, as we discussed earlier, orthosis can limit joint movement, so it will be hard for patients to perform normal locomotions when they're wearing orthosis. This can lead to frequent off-balance, which simply means that the patients are easily falling down. So there are many debates about wearing orthosis during daytime, and I would like to share with you some of those. So firstly, Mrs. Smith at Strainer Hospital for Children in Florida said, daytime AFOs are not usually tolerated due to the need for patients to adjust their center of gravity forward to balance, with increased plantar flexion at the ankle and increased lumbar lordosis, which occurs due to quad and gluteal muscle weakening. However, a research study came out later, and the lead author Dr. Matielos Verzat said, our recent study showed that daytime AFO use decreases the incidence of falls and is well accepted by patients with DMD if they choose to wear it. And later on, Mrs. Rubinstein at the Anne and Robert H. Lurie Children's Hospital of Chicago noted that the published study showed improvements in the 10-minute walk test. However, she said that based on her experience, this may not be the case after a full day in the device. And Mattiello-Sverzat's group did call for further study into whether their result would hold up over time. So, is it appropriate to wear orthosis during daytime? The answer is nobody knows. It really depends on specific patients. However, the debate about orthosis during daytime leads to another discussion. If people cannot tolerate wearing orthosis during daytime, what about wearing them at night? Because you don't need to worry about falling down at night. And the answer to that question is there are other problems for wearing orthosis at night. One of the main ones is people sleep in different postures. One needs to move and reposition himself during sleep, and orthosis can actually hinder them repositioning themselves. So the debate about wearing orthosis during sleep includes which type of orthosis is better. So basically, strapped orthosis allow for some degree of movement, while articulated orthosis does not allow any movement. Some parents actually report that strapped orthosis are worse because they more frequently wake up their children at night. There are also debate about whether patients should keep on wearing orthosis when they are no longer ambulatory. And there are even suggestions for non-ambulatory patients that they can wear orthosis during daytime as a supplementary, because non-ambulatory patients do not worry about falling down during daytime, and sleep quality would have higher priority for them. So in conclusion, we really do not have a conclusion about whether orthosis is beneficial for DMD patients in general. All we can say now is that it is a very personal thing. If one can tolerate wearing orthosis, they can definitely elongate their ambulation. However, if one cannot tolerate wearing orthosis, they can also lead to some negative consequences. However, there is one thing I think all of us would agree, and that is all our efforts are to improve patient experience. We want them to improve their life quality. So Kirk Ferris from Mary Free Bed Rehabilitation Hospital says, every provider's expertise is directed at getting patients with DMD up and moving for as long as possible. And I think that concludes my presentation today very well. I hope that more and more advanced treatments can be available in the future, and all DMD patients can get the best treatments. Thank you for your attention.